Diabetic ketoacidosis, or DKA, is a serious and potentially life-threatening complication of diabetes that can occur when the body doesn't have enough insulin to allow blood sugar to enter cells for energy. It is most common in people with type 1 diabetes, but people with type 2 diabetes can also develop DKA under certain circumstances. Insulin normally helps glucose, the sugar in your blood, move into cells to supply energy. But when there's too little insulin, glucose stays in the bloodstream, leaving the body without usable energy. In response, the liver begins breaking down fat for fuel, producing acidic substances called ketones. When ketones build up to high levels, they make the blood acidic, a condition called ketoacidosis. This buildup of ketones and high blood sugar levels can be dangerous and progressive, and if not treated promptly, DKA can lead to serious complications and even death. DKA often develops gradually, but symptoms can worsen quickly if ignored. Early warning signs include feeling very thirsty, urinating more frequently than usual. If DKA continues without treatment, more severe symptoms may appear. Fast, deep breathing, dry skin and mouth, fruity-smelling breath, fatigue and feeling very tired, nausea or vomiting, headache, muscle aches, or abdominal discomfort. Sometimes, DKA can be the first noticeable sign of diabetes in someone who hasn't yet been diagnosed. The root cause of DKA is very high blood sugar and low insulin levels. The most common triggers include illness or infection, which can make blood sugar harder to control, missing insulin doses, having a clogged insulin pump, or an incorrect insulin dose. Other triggers can include physical injury, heart attack or stroke, alcohol or drug use, and certain medications such as some diuretics or corticosteroids. If you have diabetes and are sick, or your blood sugar is 250 mg/dL, 13.9 mmol/ll, or higher, it's important to check your blood sugar regularly and test for ketones every 4 to 6 hours. Over-the-counter ketone test kits are widely available. A high ketone level, especially when paired with high blood sugar or symptoms, is a medical emergency that requires immediate attention. If you are experiencing severe symptoms such as high blood sugar, above 300 ml/dL, fruity breath, persistent vomiting, or difficulty breathing, seek emergency care or call emergency services right away. Diabetic ketoacidosis is treated in a hospital setting. The main goals of treatment are to replace lost fluids through intravenous IV fluids, restore electrolytes, minerals like potassium that are essential for body function, administer insulin to reverse the metabolic imbalance, treat the underlying cause, such as an infection. With prompt treatment, most people improve within 24 hours, but treatment may take longer depending on severity and underlying causes. While DKA is serious, it can often be prevented with careful diabetes management. Check your blood sugar often, especially when you're sick. Keep blood sugar within your target range whenever possible. Take your insulin or medication as prescribed, even if you feel okay. Talk to your doctor about adjusting insulin based on food, activity, or illness. It's important to work closely with your diabetes care team and seek their guidance if you're unsure how to manage dosages or when to test for ketones. Diabetic ketoacidosis is a preventable emergency with the right education, self-monitoring, and access to medical care. Recognizing early symptoms and knowing when to seek help can save lives. Share this video to spread awareness and help others understand DKA and how to prevent it.